Well, there's really evolving data that narcolepsy, whether it's type 1 or type 2, is associated with increased risk for cardiometabolic disease. However, having said that, there's also evidence that's more clear for patients with narcolepsy type 1, those who have cataplexy, because the pathophysiology of type 1 is more clear, which is a deficiency of the orexin system or orexin levels. And as we know, orexin has really profound and important role in the regulation of both appetite, metabolism, but also cardiovascular function, specifically the way it helps to regulate autonomic regulation. So it does make sense that patients with type 1 are at risk for cardiometabolic disease. And, it's really quite important that as a sleep specialist myself, that I should and my colleagues should recognize this increased risk in our patients with narcolepsy, because that changes the way perhaps how we would approach that patient. But more importantly, is because it is a chronic disorder. Hopefully, they're going to get older, and the risk for cardiovascular metabolic disorders also increase with age. And now they already have this already kind of perhaps a biological basis for their increased risk, that at every visit, we should be inquiring, we should be evaluating for the onset of risk factors such as high blood pressure or other or metabolic disorders and weight gain, for example. And from the perspective, I think, of a PCP, perhaps even cardiologists, neurologists, and psychiatrists, because there's so many comorbidities, psychiatric, metabolic, cardiovascular, and neurologic with narcolepsy, that it's really important that in these specialties that we really think about asking our patients about excessive daytime sleepiness. And I think very importantly to see a simple question, for example, of like, have you ever experienced weakness when you laugh, for example? That's actually about 90% sensitive for cataplexy. So I think simple questions like this should be elicited in the patients who you have cardiovascular disease risk already, but they may also have narcolepsy. So it's really because you have to treat both of these conditions or multiple conditions to really optimize the health of our patients. I'm always promoting multidisciplinary care for patients with narcolepsy, because indeed, they have so many comorbidities, and this includes psychiatry because of the high risk for depression, anxiety disorders, cardiometabolic disease, obesity, diabetes, and also hypertension, and also heart disease. So it is really important to have this multidisciplinary approach. I think, unfortunately, that may or may not be common in practice, because it's difficult in our system to coordinate care. But because of that, I think we should make a concerted effort to be involved in a multidisciplinary approach and coordinating care. This is particularly important for like medications. We often use medications. If one doesn't know what the other is using, that can impact not only daytime sleepiness. Many medications can create more drowsiness, for example, but also I think importantly that we together are assessing and evaluating whenever we see our patients for increased risk and or for blood pressure parameters. And I think for the cardiologist or the PCP to really helping us sleep experts to evaluate for daytime sleepiness and other sleep disorders such as sleep apnea. Shared decision-making is quite important, in particular in patients with narcolepsy, really for the effective treatment. The one I think is really important to determine from each patient what, the severity of their symptoms, the type of symptoms the context in which their symptoms become worse, and very importantly, what are their activities? What do they want to be? What do they mean being functional, right? At the end of the day, we want them to be functional and to be as functional as possible. And so that could be, we need to ask about timing of their symptoms. We also want to know the severity of their symptoms, triggers of their symptoms, such as triggers of cataplexy, so that you can avoid some of those if possible. And I think very importantly, medications that they are taking that could, could make some of the symptoms worse, and or perhaps can also improve the symptoms. And also, what are they doing during the day? What types of activities are they engaged in? It's a huge difference as whether you're treating somebody who is involved in, working with heavy machinery or driving, for example, or teaching, versus somebody who may be at a desk and there's really less safety concerns as to how much and how aggressively you want to treat those symptoms. And I think when we treat the symptoms of narcolepsy, because we don't have a cure for narcolepsy, it's important to consider what are these side effects of some of these medications, like some of the stimulants. They can increase blood pressure, for example. And would that be the right choice? So I think everything has to be individualized, and the shared decision-making is related to the risk benefits of treatments, whether they're pharmacologic or behavior treatments, but also how they align with their quality of life. Individual treatment and considering all the aspects of the patient's life, their social constraints, their professional needs is really going to be quite important. And having this multidisciplinary approach is the most likely way where we can improve the overall quality of life, but also be there alerting, be there being proactive about the potential for this increased risk of cardiovascular, metabolic, as well as psychiatric disorders. So I think although narcolepsy we think of it as a rare disorder, just to put in context, it's really almost as common as multiple sclerosis. So it is rare, but we are almost all of us, whether we're in primary care or even in cardiology, we're very likely to encounter patients with narcolepsy. So it's really important to be proactive and ask about excessive daytime sleepiness, ask about that one question about possibly cataplexy. And I think, as I said earlier, it does take a multidisciplinary village to really optimize the therapy and management for our patients.